Hello everyone, my name is Abby, and this is Nate, and welcome to this information session. If you have joined us today, or are viewing this video at home, we assume you have some interest in the upcoming trip to Swaziland in September.
Since we have a lot of information to take in, we thought we'd present this in a very simple way. We're going to cover the who, the what, the where, the why, and the how of continuing the issue of HIV in women and children in Swaziland.
Before we dive into this issue, and the upcoming trip to Swaziland, it is important we explain who we are and what we do. We are Doctors Without Borders, or Médecins Sans Frontières in French. Our core commitments are independence, neutrality, and impartiality. These are the ideals that are driven every aspect of our work, from medical care and logistics to finance and communications.
We provide free medical care to people who need it. It doesn't matter which country they're from, which religion they belong to, or what political affiliations they have. All that matters is that they are human beings in need. Being a medical humanitarian organization means choosing to go and respond to where an emergency or crisis has left people with no health care in order to save lives and alleviate suffering.
The international humanitarian action is a response which comes when the local capacity is unable to deal with the situation and provide people with the assistance they need. This can either be coping with a short-term acute emergency, for example by treating those wounded in a war, or to access services that would normally be available but are disrupted, such as maternal health care.
In this case, we head just east of South Africa to the small country of Swaziland, also known as Eswatini. But for this presentation, we're going to continue to call it Swaziland. Swaziland is one of the world's highest rates of HIV. This affects 1 in 3 adults, and this covers the where portion of the presentation, don't you think, Abby?
Yes, as you can see from this map, despite its small geographical size and population size, Swaziland has the highest HIV prevalence in the world. Let's continue with who is being affected. The answer is simple: women and children. The top 3 populations affected by HIV in Swaziland are women, orphans and vulnerable children, and female sex workers. Yes, HIV affects men as well. However, the prevalence among pregnant women is 39.2%. More than 200,000 people are living with HIV out of the country's population of 1.1 million. And approximately 17,000 children are exposed to HIV infection at birth annually.
In Swaziland, as many African countries, women are the backbone of the communities. They maintain the household, collect water, generate income, and carry the burden of taking care of sick family members. This stabilizing role played by women is disappearing as the HIV pandemic takes its toll. Women between the ages of 15 and 49 are reported to be more than half of all infections. Women are disproportionately affected by Swaziland's HIV epidemic. Of the 210,000 people living with HIV in 2017, 120,000 of them were women. In the context of the entire population, 35.1% of all women are living with HIV compared to 19.3% of men.
National estimates indicate that there are presently about 130,000 orphans and vulnerable children in Swaziland. These children are either HIV infected or have parents who are so ill that the children need support and protection provided by the community or government. In 2017, 13,000 children aged 0 to 14 years were living with HIV.
As I mentioned above, numbers indicate that women aged 15 to 49 have an HIV prevalence rate of 35.1%. Children aged 0 to 14 have an HIV incidence rate of 1,100, and women aged 15 to 49 years of age that are newly infected with HIV is estimated to be 3,500.
Okay, let's discuss the what. Some important questions are, what is HIV/AIDS, and what is being affected by this epidemic? HIV/AIDS continues to play a major role in the declining economy of Swaziland today. The impact of HIV and AIDS has led to the disruption and destabilization of families and communal support systems, and a dramatic increase in the number of vulnerable children and child-headed households.
HIV stands for human immunodeficiency virus. Unfortunately, once you develop HIV, it cannot be cured, even with treatment. You have it for the rest of your life. HIV is transmitted via sexual transmission, injection drug use, perinatal transmission, transmission by blood transfusion, blood products, and organ transplants. In regards to the women of Swaziland, heterosexual transmission is by far the leading cause of transmission. In turn, children are born with HIV via perinatal or vertical transmission.
HIV attacks the body's immune system, specifically the CD4 cells, or T cells, which help the immune system fight off infections. If HIV is left untreated, the number of T cells in the body is greatly reduced, making it very easy for individuals to acquire other infections, such as TB and infection-related cancers.
When and why do we need to take action? As for the when, this trip is set to be in September. This will allow us to generate interest now, gathering volunteers and reviewing applications over the course of the summer. Around the beginning of August, we have chosen our volunteers that will join us on this endeavor.
We're coming down to the last two sections of this video. I'm sure many people ask why. Why is it important to make this trip to Swaziland to aid this population with this epidemic, and why is HIV so prevalent in Swaziland compared to other countries? Let's start with the Millennium Development Goals. As Doctors Without Borders, we strive to make progress within these goals. This trip specifically targets goals 4, 5, and 6.
These specific goals are to reduce child mortality, improve maternal health, and combat HIV, AIDS, malaria, and other diseases, but we're going to focus specifically on HIV and AIDS.
So why has HIV become such a prevalent issue in Swaziland?
Good question. There are many factors that could contribute to this, the first of which being the high population of sex workers in the region of Swaziland. There is a population of approximately 4,000 sex workers, and amongst this population, there's a little bit over 60% that are known to be HIV positive.
That would lead to the next factor being high levels of vertical transmission. Due to much of the general population contracting disease from sex workers or other heterosexual relations, it has become very easily transmitted to their offspring.
There's been quite a bit of progress made when it comes to HIV/AIDS in low-income countries such as South Africa and Swaziland. However, there is still a large amount of people living with HIV in Swaziland, and it's still the country's biggest public health concern.
Raising awareness and education amongst the 3 key populations at risk is critical for the future of the country. Educating female sex workers and mothers will further prevent the spread of HIV. In 2015, life expectancy in Swaziland was 57 years of age for men and 61 for women. This is still considerably low compared to other low and middle income countries.
So this concludes our presentation. I hope this information session generated interest and answered any questions you may have. To get more information on what to expect, what to bring, and how to get ready for a trip such as this one, please visit our website and the Facebook page for the trip to Swaziland to help combat HIV in women and children.
Thank you for attending or viewing this video at home. We will be accepting applications for volunteers starting on the 1st of May. Nate and I hope we get the privilege to work with some of you on this project.